Good morning, everyone. It's 11 o'clock, so we'll go ahead and get started. This is the Rock County Public Health Department weekly COVID-19 briefing. This briefing is being live streamed on the Rock County Public Health Department Facebook page, and the recordings are available afterwards on our Facebook page and our YouTube channel. I want to thank everybody for joining us today. We will start with some COVID updates and information from the Rock County Public Health Department, and then we will open it up to questions from the media. My name is Jessica Turner. I'm the Communications Specialist for the Rock County Public Health Department. And then also with me today, I have Nick Zupan, epidemiologist, Rick Wiederson, Environmental Health Director, and Seth Longcar, Administrative Services Supervisor. So I'm going to turn it over to Nick now, our epidemiologist, for some data updates.
Thanks, Jessica. So in terms of our case activity, we're seeing a little bit of a leveling off this week in terms of number of new cases and increases and things like that. So over the course of the pandemic, we've had 15,393 Rock County residents test positive for COVID-19. And this is an increase of about 220 additional cases since last week. We're averaging about 32 new cases per day over the last week, and this average is fairly consistent with the numbers we were seeing last week. So we're not seeing ongoing trends in terms of increase in case activity, which is good. We want to see those case numbers continue to drop. So I'm hoping that we're kind of at the top of our peak right now, and we'll see a decrease in the next few weeks here. Based on our records, we're looking at about an average of 365 cases, and there have been 167 deaths due to COVID-19. There are no additional deaths over this past week due to COVID. Most recently, we've had 10 patients in the hospital getting care for COVID-19, so this number is down as well. Last week, we had seen about 17 patients in the hospital at the beginning of the week, and the increase was a little bit startling in terms of seeing the hospitalized patient numbers double over the course of a week. Those numbers are back down, so we are seeing trends in the right direction in terms of people who have severe illness. And in terms of our vaccination numbers, we're seeing ongoing vaccine efforts, ongoing increases in the number of residents who are getting vaccinated. So as of this morning, we have 58,500 residents in Rock County who have gotten at least that first dose of the vaccine. This is about 36% of our total population. And just under 42,000 residents have completed the vaccine series, which is about 26% of the total population. So with that, I'm going to turn it back over to you, Jessica.
Thank you, Nick. I'm now going to turn it over to Seth for a couple of additional updates.
Thank you, Jessica. Currently, with the Johnson & Johnson vaccination, it is still paused out of an abundance of caution. A virtual emergency meeting of the Advisory Committee on Immunization Practices, the ACIP, will be held tomorrow, Friday, April 23rd, 2021, to discuss the Johnson & Johnson vaccination further. And we'll know more information after that meeting takes place. In general, vaccination appointments are becoming easier to find. Rides to vaccination appointments for those who need them are now available by calling 211. There are many other options for locations to getting vaccinated. This week only, you can get an appointment for the drive-through clinic at the Alliant Energy Center in Madison. The link for that is on our Facebook page if you are interested. CVS, who just started offering COVID vaccinations in Rock County, and Walgreens frequently have open appointments. You can get an appointment at the DHS community-based clinic in Rock County, located at Blackhawk Technical College, by registering on the state vaccination registry, or you can also call 1-844-684-1064. In addition, you can also go to rockcountyshot.com or vaccinefinder.org to locate more information on finding vaccination appointments. And with that, I will turn it back over to you, Jessica. Thank you.
Thank you for those updates, Seth. Now Rick is going to talk a little bit about some COVID wastewater testing that is happening.
Yeah, a little different topic to talk about today. It's a relatively new tool that public health has to in the fight against diseases, and that's using wastewater testing, in this case, to look for the virus that causes COVID-19. So there's been a Wisconsin coronavirus wastewater network that's been developed. 65 wastewater treatment plants in Wisconsin are currently testing for the virus, with a goal of 100 wastewater treatment plants that would eventually represent about 60% of Wisconsin's population. So monitoring wastewater for the virus is a good way of finding early detection of the virus within the community. The virus can be detected in feces shortly after infection and even before symptoms develop or when people are asymptomatic. The amount of virus in wastewater can be tested to see whether levels are trending upward, whether they're decreasing. And it really only takes one test from a wastewater treatment plant to get this assessment versus individual tests that people are doing. Wastewater, as I said, is an early warning in a community of trends. Beloit and Janesville are included in this wastewater testing program. And over the past few weeks, the testing levels have been relatively stable in Janesville and in Beloit. We are also have the ability to monitor our neighboring counties of Walworth and Greene County, which are also seeing relatively stable trends over the last weeks. In Dane County, Madison is seeing a decrease in the virus levels that are showing up in the wastewater. If Department of Health Services observes any changes in the wastewater data or trends, they will send out an alert to those jurisdictions. Wastewater monitoring does not replace normal traditional COVID-19 tested, but it does provide a broad understanding of the activity in an entire community at one time. DHS has also been working closely with the CDC to refine these methods and develop different categories of trends that will be used from this point going forward. This type of surveillance is also being considered in the future for monitoring other types of diseases that potentially could show up in our communities. So it's a nice tool that's been developed. This project is a collaboration between the Wisconsin Department of Health Services, the State Lab of Hygiene, and the University of Wisconsin-Milwaukee. I'll send it back to you, Jessica.
Great, thank you, Rick. So we will now open it up to questions from the media. It looks like today we have one attendee, Ashley McCallum from the Janesville Gazette. So Ashley, we'll just go ahead and give you the ability to mute and unmute yourself, and you can go ahead and ask any questions that you have.
Great, thank you. Hi, everyone. Thanks again for hosting this. Starting off today, we're seeing reports coming from communities kind of in some areas across the country, and I haven't seen too much in Wisconsin yet, but reports saying that there's slowing of vaccine demand in some places. And I was wondering if we're seeing any changes in demand locally, and if so, what could be done at the onset of that to help, get more folks out and getting appointments.
I can go ahead and start answering that question, and feel free anyone else to jump in. In terms of the data, we are probably seeing a slight decrease in the rate of increase in terms of our vaccination numbers. I think people who are very highly motivated to get the vaccine have figured out how to do that. At this time, we're seeing anywhere from kind of a daily increase of 250 to about 1,000 individuals who are fully vaccinated in terms of our numbers. And this is going to be a challenge moving forward to make sure that we're getting the vaccine to out into the community, especially for those individuals who may be facing barriers to getting out to the currently available sites or accessing the vaccine that's available at the pharmacies or the healthcare providers, we have a number of community-based vaccination sites that will be occurring in the next few weeks here, which is pretty exciting. So trying to reduce some of the barriers in terms of transportation. And as Seth mentioned, there is transportation resources available. So we're trying to promote people utilizing those resources to get access to the vaccine. But this will be an ongoing challenge, and we're working hard with our partners across the community to try to address the challenges that people have to getting the vaccine, so everyone who wants a shot can be vaccinated.
Thanks, Nick. I will also add too that that is definitely something that is being seen nationwide and is somewhat expected, because there will only be a certain percentage of the population that is willing to get the COVID vaccine. There are some people that may not necessarily want to get vaccinated. There are some people that have some questions, have some concerns, which is understandable. And we just encourage everyone to research those vaccines, to get some more information, to seek out the answers to their questions and concerns. And we are actively working on finding out what those concerns are in our community and addressing those.
Great. And our neighbors over in Walworth County, health officials over there have said they're seeing a noticeable amount of people getting a first dose and then not showing up for their second dose appointments. Are we seeing that in Rock County? And if so, I guess how do you try to get those folks in to get those second appointments at some point?
Yeah, so when we have looked at our data, we're seeing less than 2% of the individuals who have gotten that first dose kind of not showing up for their second dose. And the way we define that is anyone who got the first dose, they have kind of a 6-week window to get that second dose before the CDC considers them kind of late to getting their second dose. So we're currently taking a look at the data related to those individuals and seeing if there are trends in terms of locations, age demographics, race or ethnicity variations, and things like that. And I think the next steps are to start to reach out to those individuals and with reminders, and also try to get some more information from those folks to see kind of what the reasoning is behind their decision not to get the second dose.
Great. And I guess, 2%, is that a percentage that's considered expected? Is it higher or lower than what you would think to see? I guess, how would you qualify what that 2% number means for us?
I'm not sure how to qualify it at this point. I think it's to be expected that there will be a percentage of the population after getting that first dose may decide not to get it. Unfortunately, there are individuals who have passed away since getting their first dose of the vaccine. So it is kind of something we see in the realm of vaccines beyond COVID-19, because this is a relatively new vaccine and a very kind of unprecedented circumstances for getting the vaccine out to the community. I'm not really sure how we compare this to other situations, but it is unfortunately to be expected that not everyone will follow up with that second appointment. If we can work with our community partners and identify some of the issues that people are facing to getting that second dose, we may be able to drive that percentage down. But it's something we'll continue to monitor moving forward, and I guess we have at least a baseline to compare to in the future.
Yeah. Great. And then kind of still in the realm of vaccine hesitancy, or, folks who haven't been going out or as eager, there's been some national, or I guess there's a lot of conversations about helping educate people who might be from different ethnic or class backgrounds or people of color. But some national polling shows that actually one of the highest groups of people who are hesitant tend to be Republican leaning, specifically Republican men or white evangelicals. Are there efforts to look at those populations at all? I know that's a little bit more of a fluid community. It's not maybe as easily found. So how do you kind of address people who might fit into that category?
That's a great question, Ashley. Thank you for asking that question. We are looking at the community as a whole and trying to gauge overall what the biggest concerns are and what the biggest points of hesitancy are, and addressing those with the community as a whole to reach anyone who may have those same concerns and hesitancies.
All right, great. Well, if there's anything else that anyone want to jump in on, feel free. I think otherwise that's it for me.
Great, thank you, Ashley. Thank you for participating today. So I think we can conclude the media briefing today. I just want to remind everybody that these briefings take place every Thursday at 11 a.m. They are live streamed on the Rock County Public Health Department Facebook page. If you're not able to join us live, those recordings are always available on our Facebook page and our YouTube channel. If anyone from the media would like to participate in these briefings and have the ability to ask us questions live, please reach out to me. The email address is media.publichealth@co.rock.wi.us, and I can send you the information to allow you to participate in these briefings. Thank you again, everybody. Have a great week. Stay healthy and stay safe.